The exercise that our group focused on is the pelvic/hip bridge, which is an exercise that primarily targets the gluteal muscles while secondarily targeting the hamstrings. It is considered an isolation exercise because movement occurs at one joint, the pelvis, and in doing so mainly targets a single muscle, which is the glutes. This is also a closed kinetic chain movement and is most commonly performed with no equipment from a supine position on the ground. So the primary muscles involved are going to be the gluteal muscles, which are going to be providing hip extension throughout the movement, as well as the hamstrings, which will be supporting that hip extension provided by the gluteal muscles. The primary joints involved are the hip joint, which is where most of the movement will occur, and the tibiofemoral joint, which will be supporting the movement through the hip. As you can see here, the image on the left is demonstrating the starting position of the movement. The subject is in a supine position with both the hips and knees in flexion. To begin the concentric phase of the movement, the gluteal muscles and hamstrings, both defined by arrows in the second picture, will contract, moving the pelvis from flexion into extension, signaling the end of the concentric phase, which is pictured in the image on the right. The gluteals and hamstrings will then relax during the eccentric phase, bringing the hips back into flexion into the supine position on the left.
Alright, so in order to do the pelvic bridge correctly, you'll first want to start by laying on a flat surface, a mat, the ground, whatever you want. You should bend your knees enough so that the edge of your fingertips can brush against your heels, but not too much closer to your gluteal muscles. You should then place your arms to the side at about a 45-degree angle or whatever is most comfortable. You'll then want to focus on flexing your abdominals in order to push your lower back into the floor. This will help keep your torso and spine in a neutral position. It'll also lift the gluteal muscles off the floor and create a posterior tilt of the pelvis joint. Then you'll want to slowly lift your back off the floor, one vertebrae at a time, until your torso creates a 180-degree angle with your thighs. So they should be completely parallel. Your body should look like a board. At this point, that's where you should stop the exercise. Your knees should be over your heels. That would be the most stable position to end in. Your glute should be activated. Your hamstring muscle should be activated. And then, once you reach this and hold for a moment, you can then stop the exercise and slowly lower back down to the ground. Something else to keep in mind is that your cervical spine should not be flexed. So your head should be on the ground, relaxed. This will help keep your airways open and make sure you're getting enough oxygen to all the working muscles.
The first common mistake that people make is overextending the hips and lumbar spine. Instead of ending the concentric phase of the movement while the hips are in a neutral position, they continue extending their hips and in turn extending their lumbar spine, which places unnecessary stress on it. When the bridge is performed properly, the torso and upper legs create a 180-degree line at the top. When the hips overextend, the lumbar spine moves farther and farther away from the straight line. As the distance increases between that lumbar spine, there's more torque generated, and the more the spine is placed under increasing amounts of stress. One way to prevent this from happening is practicing the exercise slowly. You roll the pelvis forward one vertebrae at a time, lifting the back off the floor, until you reach that 100-degree angle that's created between the torso and upper leg. Another common mistake that people make is misaligning their feet while they are in the supine position. If the feet are placed too far away from the buttocks, there is a greater chance that the hamstrings will be the primary muscle used in achieving hip extension, and if the feet are placed too close to the buttocks, the knees have a greater chance of being pushed forward over the feet during the concentric phase of the movement. These both place unnecessary stress on the tibiofemoral joint. At this point, the axis of rotation would no longer be over the base of support. This lengthens the external moment arm and creates a larger external torque on the knee compared to if the exercise was performed correctly. Another mistake that's not depicted here is having your head lifted upward and extended cervical spine. This could cause airway blockage, which would lead to a decreased inspiratory volume. This could in turn result in insufficient oxygen intake and distribution to the active muscles.